Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
And thank you so much for joining us today. Happy Heart Health Month. And today we're going to be going over Heart Smart After Cancer. My name is Blair Avendano. I notice that I recognize many of your names. I do a lot of the Oncology Nutrition 101 training, as well as the Cancer Support Community seminars. So I'm so happy that you are here with me today to focus on a topic that is very near and dear to my heart. Just full disclosure, my husband just went through cancer treatment and happened to have some cardiac issues that have since been resolved. I am also a cardiac patient as well. And so I'm happy that you're here. I'm happy to share some of what I've learned both as a professional and as a person. So heart disease is a big deal as it is the leading cause of death worldwide. When we talk about a heart attack, we're referring to that blocked blood flow to the heart muscle. And when the blood flow is either reduced or stopped, that part of the heart is not going to get enough oxygen. And a stroke is similar in concept, except we're talking about the brain. The blood flow is not making it to the brain. And I'm sure many of you have heard of the term atherosclerosis, and that's just the gradual buildup of plaque made of cholesterol, fat, and other substances inside the arteries. And over time, that buildup can narrow the vessels and even lead to clot formation. So why are we talking about this today, and particularly with the cancer support community? It's because some cancer treatments, including certain chemotherapies, even radiation, hormonal therapies, and some of the newer targeted therapies can increase long-term cardiovascular risk. And so in survivorship, we don't just tackle the prevention of cancer recurrence, but we also want to look at your cardiac health as well. So part of empowering yourself is knowing your numbers and making sure that you are measuring them, particularly if you've struggled with a higher blood pressure in the past, making sure that you're taking your blood pressure at home. Optimal blood pressure is going to be less than 120 over 80, and even that slightly elevated blood pressure over time can increase your risk for heart attack and stroke. And then also your blood glucose levels. And I find that a lot of patients are not aware that glucose control can also affect your heart. But we do need to be very mindful of that as well. Ideally, your fasting when you go to the oncologist or to your primary, it should be under 100, and then post meals under 140. And then once again, it's an overtime type of thing. It's not like one high blood pressure is going to lead to something negative necessarily, one slightly high blood pressure or a high blood glucose read, but it's over time that blood glucose that's too high can increase inflammation and then cardiovascular risk as well. So cholesterol, we look at several components. Not all cholesterol is bad. HDL is what's known as your good cholesterol. Higher is better. They're saying now that over 60 is going to be ideal. We want men to have at least 40 and then women 50. And then LDL, it's been a while now since they decreased it from the recommended under 130. Now it's recommended to be under 100. Triglycerides under 149, and then that total cholesterol level under 200 is what is recommended. So I sound like the bearer of bad news as I start this presentation, but the good news is that approximately 80% or even more of heart disease is preventable, which I think is an incredibly powerful statistic. So there's some things, of course, we can't control that are risk factors. And men are getting younger and younger with heart issues, but men over the age of 45, we want to watch blood pressure and other heart measurements. Women over 55, you can't control the gender. There is a higher prevalence of CVD in men than women. Race you cannot control. African Americans have a higher risk of heart disease, and the Asian population has the lowest risks. And family history as well, we can't control that either. But look at what we can control. Modifiable risk factors, we can stop smoking. You can limit or avoid alcohol. We can spruce up your diet. You can attain or maintain a good weight for your height. You can obtain or maintain good blood glucose levels. You can become more active. You can get that cholesterol down using diet medications. And then also high blood pressure is a modifiable risk factor. So I'm going to touch on a little bit the balancing the blood glucose levels. When you hear of carb counting, that's more so for diabetes management. That's where it's used a little bit more formally. I do want to make a point that carbs are not evil. We just want to be eating the right type of carbs in approximately the right amount. We want to make sure to balance them with protein or a fat, and then also fiber. High fiber foods can help to regulate that blood glucose level. So making sure primarily pairing it with a protein source can balance it and prevent those upward shoots in glucose. Regular exercise after a meal, even a 10 or 15-minute walk, can be helpful and blunt a blood sugar spike. Sleeping is helpful. Poor sleep, unfortunately, increases insulin resistance and can cause increased cravings for high refined sugar foods. So, making sure that you're getting adequate sleep. Getting that stress level down is helpful because that can cause sugars to go up. Staying hydrated. Dehydration can falsely elevate blood glucose levels. So, just make sure you're hydrating throughout the day, particularly with the hotter weather on the horizon. And then maintaining somewhat of a consistent eating schedule, not skipping meals, eating snacks if needed, particularly if we're trying to get that weight back up after treatment. We're going to want to make sure that you attain or maintain a good eating schedule. So here are just a few snack ideas. And again, you'll see the carbohydrates paired with either protein, fiber, and or fat. Peanut butter and apple slices. A lot of us had this as a kid. The apple is going to be that carbohydrate source. It's also going to have some fiber, and then the peanut butter is a good fat source. Fruit and cheese, there's some fat and protein in the cheese, and then fruit is going to be the carb. Yogurt's going to have some protein as well, and then granola is going to be a carb. Certain types of veggies, even non-starchy vegetables, do have a little bit of carbohydrate. And then hummus is a good fat source, and it also has a little protein. I wish I liked cottage cheese. I hope y'all do. It's incredibly healthy, but that's going to be a wonderful source of protein prepared with fruit. And then nuts and fruit is another snack that we recommend, as well as avocado toast has some good healthy fat in it to go with your toast. And we would prefer that that be a whole wheat or a whole grain toast. So again, these are the different types. I'm not going to go over them in detail right now, but again, that good cholesterol is going to be the HDL, and that's going to carry the excess bad cholesterol out of your blood and get it away from your heart. The LDL can stick to the vessel walls, which can reduce or block the blood flow. And then triglycerides is another type of fat that's in your blood. Oftentimes, triglycerides are raised when a person consumes too much alcohol or too much refined sugary foods. So, limiting both of those sources can help to get those triglycerides down. So, how do we lower our cholesterol? I'm not as concerned with eating total fat because there are a lot of good beneficial fat sources. We want to eat the right types of fat, which we'll talk about. Eating less saturated fat. So that's going to be your fatty cuts of red meat, processed meats, like your ham, salami, things like that. Full fat dairy. Dairy is not bad, but full fat dairy we want to eliminate. Butter, coconut oil, things of that nature. Next is trans fat. So that's going to be mainly found in processed and packaged foods, if there even is any, because that's pretty highly regulated and has been eliminated from a lot of our foods. If you do look at a label and see the words partially hydrogenated oil, that means that that product does have trans fats. So that would be maybe looking in the bakery. At some of the grocery stores, but again, there's not many products with trans fat. Bumping up that fiber intake, particularly soluble fiber. I'll go over some sources in a minute. I have a success story. My mom, actually, they say that a family member doesn't listen to you, but my mom does. Her cholesterol was over 240, and just by strictly eating more fiber, getting more fiber into her diet, within 3 months she got it down below 200. And so definitely eating soluble fiber and then not consuming those A lot of cheese and fatty meats and things like that can be helpful. And you can see a significant change in a pretty reasonable amount of time. And then exercising 30 minutes a day may help raise your HDL or good cholesterol. So fiber, every dietitian loves to talk about fiber. The adult recommendation is 25 to 35 grams total a day. And if you have MyFitnessPal or if you're tracking right now, if you had that maybe that goal at the beginning of the year to track what you're eating, look at how much fiber you're getting in. The average adult only consumes about 10 to 15 grams a day, and that's just the average adult. So some consume even less. So if possible, try to bump up your consumption. There's two types of fiber. The first is insoluble fiber. Your plants, wheat, rye, brown rice, whole grains, and veggies. That's going to be a lot of your non-starchy vegetables. That's going to increase your fecal bulk and help with bowel movement. So a lot of times if a patient has constipation, we'll recommend that they increase their intake of insoluble fiber, excuse me. And then soluble fiber, what I was talking about for cholesterol decreasing, is going to delay the gastric emptying, slow glucose absorption, and again, can lower blood cholesterol. So this is going to help your stool to bulk, and consuming foods such as apples, applesauce, bananas, some of the citrus fruits, carrots, oats like oatmeal, barley, and beans can be very helpful. So if a patient has diarrhea, we recommend that they increase their intake of soluble fiber, or if they want to decrease their cholesterol. So we recommend also that please increase your fluid intake if you're going to increase your fiber intake. Otherwise, it can cause a little bit of GI distress, and we don't want that to happen. So total fat, again, I'm not as concerned with the total fat as some of the types of fat that people consume. Typically about 50 to 60 grams a day total is about what is needed, and approximately 20 to 35% of total calories a day. It is important to remember that for both blood pressure regulation, heart health, and for preventing or reducing the risk of cancer recurrence, it's important to attain a healthy weight. And every gram of fat has 9 calories, whereas every gram of protein and carbohydrates only have 4. So that's just important to remember that we want to not eat too many high fat foods just because it's very energy dense or pretty high in calories. Again, there's trans fat that I mentioned before, cholesterol itself, saturated fat. The unsaturated fat that's going to be your healthier fats, monounsaturated fats found in olive oil, avocados, and nuts. And the polyunsaturated fat includes the omega-3 and omega-6. And omega-3s in particular are beneficial for heart health because they could potentially reduce inflammation. So want to make sure that you're eating your fatty fish like salmon, also walnuts, chia seeds, and flaxseed. All right, so now we're going to dive into blood pressure a little bit more. That was a little bit of general heart health information. So we'll start by just talking about what is blood pressure. We know every time we go to the doctor's office, we have to have our blood pressure taken, but why? What is it? So it's the force of blood pushing against your artery walls as your heart pumps it throughout the body. As many of you already know, it has a top number and a bottom number. That top number is called systolic, so that's when the heart beats, and the bottom number is diastolic, and so that's when the heart rests between beats. The pressure is important because, again, it delivers oxygen and nutrients to our body, but it can become unhealthy, which we know is hypertension, if it's consistently too high, because that strains the heart and vessels and then, again, increases our risk of heart attack and stroke. So oftentimes, more often than not, it is asymptomatic, so you don't even know when your blood pressure is high. It has been coined as the silent killer because it doesn't necessarily have any side effects. But again, it increases the risk of heart disease, stroke, kidney disease, as well as vision loss to have it blood pressure high over time. So these are the guidelines here. As I mentioned before, 120 over 80 is optimal. Elevated, the systolic between 120 and 129, so just a little bit elevated with the diastolic below 80. Stage 1 hypertension, 130 to 139 systolic or 80 to 89 diastolic. And then stage 2 is going to be over equal to or greater than 140 systolic and above 90 diastolic. And then severe hypertension is higher than 180 over 120. And so as you get higher, the more likely the your physician is going to probably prescribe some medication. So just making sure that you're adherent to those guidelines, and then also working with your diet and lifestyle can be helpful in managing higher blood pressures. So what can you do? Again, we want to talk about what we have control over for blood pressure, and these are 6 different lifestyle habits that you can implement if you're not already doing so. So maintaining a healthy weight is very impactful for both cancer survivorship and blood pressure control. And even small changes, even like 5 to 10% of your body weight, can improve your cardiovascular markers. Limiting or avoiding alcohol. If you've been to any of my seminars, you hear me talk about this, but there is no safe amount of alcohol, particularly for cancer recurrence. It can also raise blood pressure, and so we just want to make sure to limit or even better, avoid. Stress management is important to try to do, as chronic stress can elevate your blood pressure and also cause inflammation. So, whatever you like to do to get that stress down, whether it's walking, meditation, talking to a friend, um, deep breathing, prayer, all those types of things is, important to implement into your daily life. We'll go over this as a dietitian. Obviously, I'm going to talk about this more in more detail, but a healthy diet, very important in blood pressure management. Avoiding tobacco is critical for both heart and cancer outcomes. And then just regular monitoring. You can ask if you have a cardiologist or a primary or your oncologist, how often you should be monitoring that blood pressure, and then just making sure to adhere to that. So I know that we have all heard about too much sodium can cause higher blood pressure, and that is, very much so true. But the encouraging part is when the blood pressure improves, cardiovascular risk can decrease. But the American Heart Association recommends keeping sodium intake under 2,300 milligrams a day and even lower if possible. And then sometimes if a patient has like CHF or kidney disease or something like that, the physician will recommend a lower sodium intake per day. But to put this in perspective, 1 teaspoon of salt, everybody picture a teaspoon, that in and of itself is 2,300 milligrams of sodium. And so that is your daily intake strictly in 1 teaspoon of salt. When we look at the food label in a minute, I'm going to talk a little bit more about this, but the goal is approximately 600 milligrams of sodium per meal. So if we're doing our math, that's 1,800 for meals, and then that allows a little bit of sodium for snacks and to still stay under that 2,300. Um, Processed foods or snacks, we just want to look at that food label and make sure that it has less than 130 to 140 milligrams of sodium. So that would be a good snack choice. So I get a lot of patients that are surprised by what we call the salty six. As it says on the slide, about 70% of the sodium we consume comes from processed, prepackaged, or restaurant foods. Um, Breads and rolls are actually very high in sodium. And then if we think about pizza, it has what? It has bread, it has sauce, which is high in sodium, um, potentially pepperoni or some of the processed meats, and cheese. So pizza is incredibly high. Cold cuts and cured meats, which go on sandwiches, which are made of bread, all that is high in sodium. Soups, not as many patients are surprised about. That's pretty common knowledge. Burritos and tacos, that's another common source. But some other hidden sources of high sodium can be buttermilk, salted snacks, frozen dinners, and snack foods are a big one. So making sure to look at those labels to make sure that they're not too high in sodium. Condiments like ketchup, mustard, pickles, olives, any type of seasoned salt, so onion salt, garlic salt. If it has the word salt in it, it's going to be high in sodium. And then also sauces like barbecue, soy sauce, even the light soy sauce, that just means it's lighter than the original, is going to be high in sodium, as well as steak or Worcestershire sauce. So we do need to educate ourselves. And if you're not already label reading, I would recommend that you start label reading. And then the first thing that you want to look at is serving size. And so for example, if the serving size of cereal, we'll just say, is half a cup on that label and you eat a full cup, you're going to need to multiply everything on the label by two. So this would be 560 calories, 8 grams of fiber, that kind of thing. And then the sodium would go from 160 to 320. And so if you ate half of a cup of that cereal, it would be a pretty okay source of sodium. But if you multiply it by two, it's 320, and that's when it becomes a higher source, depending on what you pair it with. So again, just about 600 milligrams a meal is what we're aiming for. If you're going to have a higher sodium food, I would recommend pairing it with some fresh fruits and vegetables. Those are actually freebies, as far as sodium is concerned. Now, if you're monitoring blood sugar levels too, if your blood sugars have been running high, you would need to take that into consideration with the fruits. But if you're not, if your blood sugars are fine and you're just trying to get that blood pressure down, fresh fruits and vegetables are a great way to do it. You don't have to calculate that into the 600 milligrams per meal. And then again, if you're doing 800 milligrams for meals, you have a little bit of leeway for snacks in between. And so if you look at the label and it's a cup of pretzels or something like that with lower sodium. And it's under 130 milligrams. Just make sure to adhere to that serving size. And that should be fine for you to have for a snack. And this is something else I wanted to teach y'all. It's just short and sweet when you're looking at a label. A simple way to see is something high in a nutrient or low is the 520 rule. So if you're looking at the sodium and it says 5% daily value or less, that's a pretty low source. But if you're looking at a nutrient, regardless of what you're monitoring, and it says 20% or higher, that's going to be high. So for sodium, that would be, probably not the best choice for you unless you're coupling that meal with fresh fruits and vegetables or something else that's low sodium. So when you're looking at label reading or as you're starting your label reading journey, just remember that 520 rule. 5% is low, and then 20% or anything higher than that is going to be high for a nutrient. And I think most people, when they think about nutrients that are related or relevant to blood pressure, sodium's always going to come up. But some other nutrients that are key for blood pressure management are potassium. We'll talk about all of these a little bit more detail. Magnesium, calcium, as well as omega-3. So potassium is instrumental in balancing sodium levels. So that's going to help support healthy blood pressure. It's important for not just cancer survivors because some treatments can affect the heart, but it also plays a key role in muscle function as well as nerve signaling and fluid balance. And I think bananas are the poster child for a good potassium source, but there's also fruits like oranges, there's avocados that are high in potassium, potatoes, tomatoes, Brussels sprouts, and then dairy products. So low-fat dairy like milk, yogurt, and cheese is going to be a good source of potassium. I can't remember what the exact average intake for Americans is for potassium, but it is far lower than what you're seeing here for the RDA. Men are needing a little bit more at 3,400 milligrams a day, and then women 2,300 milligrams a day. So magnesium is second. So that's going to be another mineral that's going to play a powerful role in heart and overall health. So one of its main functions is to relax blood cells to support healthy blood pressure. Some sources are going to be things like spinach, your dark leafy green vegetables, nuts, legumes, seeds, dark chocolate. So that's a good way to get in your magnesium and enjoy yourself, as well as whole grains. And pumpkin seeds is one of the richest sources of magnesium. And you'll see the general recommendation, the RDA below, men 420 milligrams a day and women 320. So calcium is also important in blood pressure management. It's oftentimes associated with bone health, which is also important in survivorship and in cancer. But calcium is important with cardiovascular health because it helps support blood vessel contraction and expansion. And so that's just going to help us maintain healthy circulation and blood pressure in general. So certain treatments like chemotherapy, steroids, or hormone treatments can impact bone density. And so I'm sure that a lot of you've been told this by your oncologist, but this can increase your risk for osteopenia and even osteoporosis. So, ensuring adequate calcium intake is important for many reasons. The primary sources, as you all know, are going to be your low-fat dairy products, so your milk and yogurt, as well as fortified foods. So that's a lot of cereals are going to be fortified with calcium, orange juice, things like that. There's a lot of fortified foods with calcium. And RDA adults over about 1,000 milligrams a day, and women over 50 as well as men over 70, about 1,200 milligrams a day. And then lastly, omega-3s are important for heart health and inflammation. It's going to help support healthy blood vessel function and help reduce the inflammation in the body. So this is especially meaningful for itself because cancer and related treatments just cause inflammation in general and increase cardiovascular risk over time. The richest sources that I would recommend are fatty fish like salmon, sardines, and mackerel. There's also plant-based sources like nuts and seeds, like walnuts and flaxseed. There's a couple different recommendations on how much omega-3 you should have. The American Heart Association recommends consuming fatty fish at least twice a week. There's also some evidence saying that 3 grams a day from food and or supplements can help reduce blood pressure. Always discuss any type of supplementation with your dietitian and with your doctor, as particularly if you're on blood thinners or undergoing active treatment. So my patients will ask me, what is your favorite diet? What diet do you recommend? And I would say for both reducing cancer recurrence and for cardiovascular health, I would recommend the Mediterranean diet. It just focuses on anti-inflammatory foods like fruits and veggies. So it recommends that having about 5 to 9 servings a day. Eating the rainbow, so all different colors of fruits and vegetables, because the different colors have various antioxidants and phytonutrients, which are cancer fighting and cell protecting. And fruits and vegetables are incredibly heart healthy as well, including beans or legumes twice a week. So maybe having a meatless Monday. You don't necessarily have to be vegan or vegetarian, but just making sure to include some plant proteins. A small handful of nuts. Again, it emphasizes fatty fish, 3 to 4 ounces a couple of times a week. Having fresh or frozen fruits and vegetables. Fresh veggies and fruits are lower in sodium, and they're also can be more, they last longer and are more cost efficient and still maintain pretty good nutrients. Using olive oil, avocado oil, selecting whole grains more so than refined grains, and then adding in spices like ginger, turmeric, oregano, garlic, and basil. So when you're setting up your plate, I really like this as a visual, the my plate or the healthy eating plate. Drawing an imaginary line down your plate and filling half with fruits and vegetables or a variety of colors, and 1/4 of your plate with whole grains. So that can be brown rice, wild rice, quinoa. Um, it can also be a starchy vegetable like sweet potato or potatoes. And then 1/4 of the plate being about 3 ounces of healthy protein. So that's where your salmon or your baked chicken and your beans, if you're using that as a protein source, would go. So with a healthy diet, again, just consuming a variety of nutritious foods from all food groups is important. Um, it- Not only is it important as all foods have various nutrients that are healthy for us, but you don't want to get bored either. So just I encourage you to maybe work with a dietitian if you need some creativity and just ensuring that you're getting all the nutrients that your body requires. And then limiting saturated fat, trans fat, sodium, red meat, sweets, and then sugar sweetened beverages. Increasing physical activity, using at least the amount of calories that you're taking in, particularly for weight management. We want to increase that physical activity to burn more calories. And the goal is about 150 minutes of moderate physical activity a week. So this could be walking or swimming, or 75 minutes of vigorous physical activity a week. So maybe HIIT classes or running, things of that nature. So I think the best way to break this down, if you're not used to exercising, is break it down into 30 minutes a day, 5 days a week. And you can even break it down further to 10 minutes 3 times a day. for 5 days. And so maybe after breakfast, walking for 10 minutes, same thing with lunch and dinner. And that also is going to help you, again, prevent those spikes from blood glucose levels and get in your moderate physical activity. So, parking further away in a parking lot, taking the stairs, just anything that you can do to increase that physical activity level. So, in summary, knowing your numbers, your blood pressure numbers, cholesterol, blood glucose, this is going to help you get insight and control and help you to set goals and know when you're achieving them. The second, reading your food labels. So using that 520 rule, making sure that you're multiplying or dividing based on serving size so you know pretty accurately how much sodium or other nutrient that you're measuring you're getting in. Choose limiting fast foods and other fried foods that are going to be high in sodium and likely saturated fat. Choosing whole grains, striving for at least 5 servings of fruits and vegetables in a day, if not more, up to 9 is great. Choosing the leaner protein sources, limiting or avoiding processed meats as much as possible. Put down that salt shaker. It's not good. As I mentioned earlier, one teaspoon has 2,300 milligrams. And so it's best just to not add extra salt to your food and to use spices that do not have sodium. Exercising 150 minutes of moderate or 75 minutes of strenuous exercise per week. Attaining a healthy weight, getting that stress level down, ideally avoiding alcohol. If not, just make sure to limit it, and stop smoking if you're smoking. So I want to wish all of you a very happy Heart Health Month. Make sure that you're getting down that blood pressure. Make sure that you are monitoring your intake and trying to get your weight down. And please don't hesitate to reach out, particularly if you are in treatment at Northside or have previously gotten treatment at Northside. You can email outpatient.nutrition@northside.com and I can get you set up with one of our dietitians. So I want to thank you all for joining.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.